Hello, good afternoon. I'm Dr. Basma Mahmoud, a third year medical student, and I'll be your doctor for today. So can I know what's your name and age, please?
Raf Nader, 21 years old.
Nice to meet you, Raf. So Raf, today I have to examine your pulse. This includes touching you at different sides of your body. Is that going to be okay with you?
Yes.
Thank you. Before we start, I have to make sure that the room is warm and there is enough privacy for the patient. And I have to make sure that I have a firm couch and a good source of light. I've washed my hands and I'm going to ask the patient to expose herself based on the area I'm going to examine. So now we're going to start by checking the radial pulsations. So can you please give me your arm? So the arm should be relaxed, the forearm should be semi-pronated, and the wrist should be semi-flexed. Then by using the tips of my index and middle finger, I'm going to apply slight pressure on the lateral side of the wrist joint for 30 seconds and multiply them by 2. Thank you. You can relax your arm now. So the radial pulse was found to be 72 beats per minute, normal volume, regular rhythm. But for checking the character, I have to check if there is collapsing pulse or not. So now Rahaf, we're going to check if there is a collapsing pulse or not. Before we start, do you have any arm, shoulder pain, or any restrictions in the movement?
No.
Okay, so we're going to start by checking your brachial pulsation first. So can you please expose your forearm with the right hand? Okay. So her brachial pulsation is here. Then I'm going to put my left hand on her elbows and the tips of the index and middle finger of my right hand on her radial artery. Then I'm going to raise her arm vertically above her hands. Okay, I didn't feel any vibration, then no collapsing pulse, then the character is normal. So now Rahaf, we're going to assess the synchronicity. So can you please give me your both hands? We're going to check the radial pulsation in the two hands simultaneously to check if there is a delay or any change in the volume. Okay. So now we're the radial delay. So now we're going to check the peripheral pulsations. We're going to start by the carotid pulsation first, which is located between the larynx and the sternocleidomastoid muscle. By the tips of my index and middle finger, I'm going to apply slight pressure. Okay. So carotid pulse intact. Now we're going to move to the brachial pulsation. Can you please expose your forearm? The brachial pulsation is located in the antecubital fossa, medial to the biceps tendon and above the elbow joint. So it's here. Okay, brachial pulse intact. Now I'm going to examine the femoral pulsation. So for examining it, the patient must lie supine on the couch and I have to take her permission before we start because it's a sensitive area. Now it's the time to check the femoral pulsation, which is located in the midway between the anterior superior iliac spine and the symphysis pubis. You should draw an imaginary line between them to find the mid-inguinal point and where you can feel the femoral pulsation. Okay, femoral pulsation intact. So now we're going to check if there is already femoral delay or not. So one of my hands should be in the femoral pulsation area and the other hand should be in the radial pulsation area. Okay, now we're the femoral delay. So now we're going to check the popliteal pulse. The popliteal pulse is in a posterior relation to the knee joint at the level of the knee crease, deep in the popliteal fossa. To check it, the knee should be relaxed, not flexed. So now Rahaf, can you please relax your knee? Okay. To check the popliteal pulse, your hands should be like this. So you're going to apply pressure to feel it. Okay. Popliteal pulse intact. So now we're going to check the posterior tibial pulsation, which is located 2 centimeters below and posterior to the medial malleus. Okay, posterior tibial pulse intact. So now we're going to move to check the dorsalis pedis pulsation. It passes laterally to the tendon of the extensor hallucis longus and is best felt at the proximal extent of the groove between the first and the second metatarsal. So this is the first metatarsal, and this is the second metatarsal, and this is the extensor hallucis longus tendon. So here you can feel the dorsalis pedis pulsation. So the dorsalis pedis pulsation intact, but if you don't feel it, don't worry, because it may be absent or abnormally sighted in 10% of normal people. So lastly, I have to thank my patient, but don't forget to do the same bilaterally, I mean in the two sides. Before we finish, I want to tell you the normal ranges of the pulse rate in different age groups. So the pulse rate of the fetus has to be on the average of 110 to 160 beats per minute. For the infants, it has to be 100 to 140 beats per minute. For the children, it has to be 80 to 100 beats per minute. And lastly, for the adults, it has to be 60 to 100 beats per minute. For adults, a pulse rate that's more than 100 beats per minute is called tachycardia, and a pulse rate that's less than 60 beats per minute is called bradycardia.